Hello, my friends. How are we doing? I'm in Utah, and it's really beautiful. I'm at a perfect spot, so I figured today I could talk to you about this one stretch that can help you with back pain. So I'm really passionate about helping people solve their back pain naturally. I'm a physical therapist, and I specialize in treating the spine. And I got so frustrated to see my patients taking too much pain medications, too many surgeries, and not really getting to the root of the problem. When many times the root of the problem, when it comes to back pain, well, most all the time, it's position and imbalances that our body go through because we live in a society where we're always sitting all the time and not moving enough. And the truth is, you can fix your back pain with some very simple movements, and that's what I want to show you today. So before I get started, I want to say please share this video because I'm on a mission to try to help as many people as I can. I would appreciate that. You help me spread my message. Also, what I'm going to show you is appropriate for, I'd say, 80 to 90% of all people who have back pain. Who it's not appropriate for would be people with ankylosing spondylitis. It would not be appropriate for people who have lumbar fusions, so they've already had that lumbar fusion surgery. And those are the big ones, ankylosing spondylitis and spondylolisthesis. So if you have a fracture around your vertebrae, it would not be appropriate. But for the rest of you, for the people who have back pain that is real centralized in low back, or if you have sciatica, or if you have shooting and throbbing pain down your leg, this is going to be something that could radically change your life because you can learn how to treat your own pain naturally and not have to rely on pain meds and costly surgery. So I would love before I get started, I would love to hear from you guys. Please check in. Let me know maybe where you're from, how you're feeling today, and anything else you'd like to say at all. I'd really appreciate that. So yeah, give me emojis and thumbs up and all that. So before we do this, there's two things I'm going to show you because we have to have a baseline of where you're at right now. So first of all, I want you to think of what your back pain is like right now on a scale of 1 to 10. Just subjectively think about that in your mind on a scale of 1 to 10 because we're going to do this stretch and come back to it and then ask yourself again what your back pain is like on a scale of 1 to 10. The other thing I want you to do is stand up and go ahead, put your hands right here and just gradually see how far down you can go. So maybe you can go down all the way to the floor, maybe it's only right here, but just sort of get a sense of how far you can bend forward. Okay? So we've got our pain level and we've got how far we can bend forward. The next thing I want you to do is find a surface. So on the ground is probably best with wherever you're at. You know, if you're out in public, you can always wait till you come home to do the stretch. But a firm surface is what we're looking for, so not a bed, but a therapy table or a massage table would work very well. Okay, so all that said, let's go ahead and begin. So what we're going to do is just come down and very gently, from this position here, just come up on your elbows. This is the first thing you want to do is just breathe and just relax. And in this position, the main thing we're focusing on is relaxing your glutes, letting go of any tension that your body might want to hold on to in your glutes because we have to allow our back to extend in this position. And you can see what we're doing right here is we're bending our back in the opposite direction, so we're extending it back as opposed to flexion, which is the position it's in when we sit all the time and when we pick things up with poor posture or really how most of us are always bending forward and surrendering our lumbar spine. So in this position, we're extending our back, just relax a little bit, nice and easy, just breathe first. If you're someone who has radiating pain shooting down your legs, sciatica shooting down your ankle, what I want to get clear to you is that you're looking for movements that help centralize that pain. So if you have pain shooting all the way down to your ankle, but then you get in this position and then it moves up to your knee, or maybe it was in your knee and now it moves up to your hip, that's a really good sign. So that's called centralization of pain. We want your pain to centralize. And in some cases you may feel more pain in the low back, but if that nerve pain goes away, it's a very good indication that you're relieving pressure on that nerve and we're moving in the right direction. So once we're here for about 2 minutes, you feel nice and relaxed, the next step is to put your hands under your shoulders and very gently press up and then relax down. And you want to keep the elbows on the inside, not poking out. Up and down. Now another thing I want you to do as you do this is your breath. So inhale on the way up. Once you're here, exhale, relax the glutes. Most of you are going to have the tendency to really squeeze the glutes as hard as you can. We don't want to do that. We want to relax as much as you can and then back down. So sometimes it helps to have a buddy who's behind you and sort of tapping your glutes. And as you're up in this position, have them tap on your glutes and you'll have the feedback to relax. And that allows you to go further in that position. Just inhale on the way up. Exhale. Relax the glutes, okay? So let's do about 5 more because we want to do about 10 total. And you want to go all the way to the end range as far as you can. You don't want to go halfway. You don't want to go 3/4 of the way. All the way. Relax the glutes, okay? Let's do about 4 more. And you're not in a hurry, it's just nice and easy. And let's just do 1 more. Okay, and really gently come back down, come back up. And now we're going to stand up, and to be able to tell if this is working for you, come back to that standing position, hands right here, reach down, okay? If you can go further, you have really done something good, okay? Because you've improved your range of motion, and that's a very good indication that when you bent backwards, you freed up a lot of those restrictions in both your tissue and your nervous system to allow you to go forward. So, we're on a good sign. The other thing I want you to think about when you stand up and kind of move around a little bit is what's your back pain like now on a scale of 1 to 10. So if it's down, that's another good sign that you're moving in the right direction. If when you try to bend forward, you couldn't go as far, then this is not the exercise for you. If you did that exercise and your pain got worse, this is not the exercise for you. If your pain stayed the same, that's okay. That's all right. So if that works for you, what I encourage you to do is do that stretch 10 times every 2 hours. And I would do that for anywhere from 5 days to 7 days until you're pain-free. Okay, because what we're doing here, again, what's happening is we live in a flexion-based society. We're sitting all the time. We're always bending forward. And we have these vertebrae, one on top of the other, kind of like stacks, right? In the middle, we have a disc. And in the middle of that disc is a nucleus. So you can kind of think of a marble on top of a saucer and 2 saucers. We're always bending this way, never bending that way, but all this bending this way pushes that marble back, and that's how we have that sciatica pain, that the disc will press, it gets pushed back so far, the disc will press into a nerve and refer pain down our back, okay? So when we bend the other way, when we extend the back like I showed you in this video, you start to push that tissue back in. You move it back in. You take the pressure off the nerve. It's super important. We're bending forward hundreds, sometimes thousands of times a day. We're never bending backwards, and we're supposed to express that range of motion. It's super important. If your pain got worse, I'm going to give you an extra bonus here. If your pain got worse, then what you likely need to do is flexion. So bend the back in the other way. You can just hold your knees and pull in. About 10 times that way. It's either one or the other, typically, when it comes to back pain for most of the issues. That's what I'll say. Let's see if you have any questions. What if you have large chested and it pulls on your back? So another thing you can do is get a therapy ball if it's difficult for you, or a bunch of pillows. And you can imagine, but hug the ball and lay in this position as you hug with a bunch of pillows. That's how you would gradually come up in this position to make it work. That's the most important thing. So that's, I think, the most important thing I wanted to get. But please, please, please try this movement if you have back pain, because what's happening here is we have a fork in the road moment. People will have pain, they will ignore the pain, they will take pain medications to numb it, and they don't feel it, but they don't get to the root of the issue. And something busts, and they have to go have surgery. And we're spending way too much money, and surgeries don't always work well. Actually, in many cases, people end up worse. So that's what I'm trying to do, is educate people on how to treat their back pain naturally, and actually created an amazing program called the Sitting Solution, which helps you not only with your back pain, we go further into things that you can do along with this stretch, but shoulder pain, hip pain, knee pain, neck pain, all of that. It's a complete program to teach you how to treat yourself so you don't have to rely on medications and pay for massage therapists for the rest of your life. So, hope you guys enjoyed that. I'm going to go dip in the pool over here. Please do try it. Please share this, and definitely check out the link above to our program, The Sitting Solution. I know you guys will love it. We put our heart and souls in that thing, and it's a game changer. So if you have any questions, leave them in the comments. I will get to them as soon as I can. I love you all.